is on his way. Teresa, do you want to stand up with us? Julia to check her. Okay, I'll be getting in just a moment. I'm always asking you. Ah, what goes around?
Yeah, thank you. We're with capitalism.
I'll get out of the way. Thank you so much for coming. You want to stand up with us? He's like, he like half said he was okay. Maybe tomorrow. Okay. We're gonna begin in just a minute. Sorry for the delay. Yeah, we don't know.
Do we look good?
Mom,
Please stop slowing down, Simon. Please stop slowing him down.
Should I move to this side maybe, make it easier?
I don't want to block you, Teresa.
It sounded like them, but it's not. Oh, no.
I don't know.
Where did this send this?
Where is he? He's like pretty athletic too. He's like pretty fast.
Yeah, well, of course.
Should we just get started, you think?
Is it rude to you?
Do you think we should get started now? Then he said he's on his way 5 minutes ago.
Case of elevator.
How is someone booking a balloon right after?
I don't know, but I don't think it should be that long. But I don't think there's something right after. Okay.
sing a song. I'm sorry, I don't do well in silence. I don't do well in silence.
We can sing, why don't you sing?
Oh my gosh.
There you go. We could all hold hands.
There you go. Okay.
It's
Yeah.
okay. It's okay. I think we could just wait. If not, we get started. And
We get started. Just walks in.
I'll go slow. I can talk a lot. I can talk a lot. Yeah.
Okay. Okay. Sorry for the delay. Thank you everyone for being here. Good morning. My name is Anusha Thodakura, Anusha, last name Thotakura. I'm the Executive Director of Citizen Action Illinois, and we are so proud to be here on behalf of the Coalition for Prescription Drug Affordability, announcing the refiling of the Prescription Drug Affordability Act, which is House Bill 1443 and Senate Bill 66. The Prescription Drug Affordability Act is an essential step that lawmakers are taking to lower the cost of essential medications in Illinois. Right now, far too many Illinoisans are making the choice between affording rent and affording their medication, affording groceries or affording their medication, and especially this winter, affording their heat or affording their medication. And especially in light of recent actions at the federal level, rolling back executive orders looking into making healthcare more affordable, especially prescription drugs more affordable, this is a way that Illinois lawmakers can take action to both lower costs for patients and taxpayers and also protect access to healthcare at the state level. So we are so proud to be here on behalf of the Coalition for Prescription Drug Affordability, which includes advocates, patients, healthcare professionals, some of us who are here with us today to speak about the importance of this bill, alongside our champions in the legislature who are sponsoring this legislation. A Prescription Drug Affordability Board is an independent body with the authority to review high costs of medications and set what are called upper payment limits that will apply at every single point of the supply chain. And that's really important because when you look at the issue of healthcare affordability, it's not just one actor or one point in the supply chain where there's the cost increases. It's at every single point. Whether it's the manufacturer or with the PBMs or the insurance industry, we need to make sure that costs are being controlled throughout the supply chain so that what patients pay either out of pocket for a medication or for their health insurance premiums or what the state pays in health insurance towards Medicaid, those costs are controlled. So I'm proud to be here with our coalition today, and I'm going to introduce our House champion for this bill, State Representative Nabila Syed.
Good morning, everyone. My name is State Representative Nabila Syed. It has been an eventful week, to say the least. But today, I am excited to reintroduce House Bill 1443, which would create a Prescription Drug Affordability Board. A board that would have the authority to review the affordability of prescription drugs and establish payment limits so no one's livelihood is threatened by their struggle to pay for their medication. A few things I do want to mention. We worked hard last session with every single stakeholder and have drafted a bill that I would say is in its best form. These payment limits will apply throughout the entire supply chain. The cost savings will be passed down to consumers, and our state will be taking necessary action to address the issue of prescription drug affordability. Another thing I do want to point out is that this bill is emblematic of how state government should work. This bill creates a board. It meaningfully engages a stakeholder council that is appointed in a bipartisan manner and puts our constituents over profits. Because at the end of the day, this is a bipartisan issue that affects all Illinoisans. And I say that because it is so important to say that now more than ever. I have to be honest about the kind of uphill battle we have been up against with stakeholders who want to keep their pockets lined with profits at the expense of our constituents. Because it is no coincidence that in the halls of this state capitol, the same companies who will lose profit when we make drugs more affordable will go around to every single one of our colleagues saying that we should let the federal government take action. We don't want the states to do it. It gets too complicated. And it is also no coincidence that those same pharmaceutical companies donated millions to finance Trump's inauguration, and that Donald Trump, on the first day that he takes office, makes it a priority to reverse several efforts to lower the cost of prescription drugs and healthcare for people. I am not interested in playing political games with people's lives because I hear from constituents in my district of all different backgrounds and ages that healthcare, specifically prescription drugs, are too expensive to afford. People are making dangerous decisions. They're rationing their medication. So I ask you, and I take this opportunity to urge all of my colleagues to join us, the incredible advocates standing here beside me, to take a stand on behalf of the constituents we were elected to represent and pass this bill to create a prescription drug affordability board. I will now pass it along to Senator Robert Peters. Thank you.
Hello, I'm State Senator Robert Peters of the 13th District and the proud sponsor of this bill. I want to ground it in a conversation we've been having over the last year about consumer prices and the cost of healthcare. What we've seen is somebody who said that they're going to lower prescription costs and help people save money while also saving lives. And then their first action when it comes to anything involving prescription drugs was actually increase the cost of those drugs. And so to me, I think what's vitally important is that we need to move beyond talk. We need to move beyond magic beans and make-believe and actually come to some action. And we have that unique solution right here with prescription drug affordability boards. This is an opportunity for us to look out for the consumer, to look out for their health care, to provide them with the drugs, the necessary drugs that they need, and not have them have to fight whether they're going to have food on their plate, whether they're going to be able to have their kids have shoes to walk, be able to afford gas or a public transportation ticket, or the drugs that they need to live their life. We cannot have and continue to do is have people do talking points about how they're going to do something and do nothing. Enough is enough. This is, in fact, a bipartisan bill. Because whether you live in a downstate county or you live in Cook County, prescription drugs are too expensive for you. Whether you live in a downstate county or you live in Cook County or DuPage County, the struggle of figuring out how to get through daily life, that impacts you. Prescription drugs play a role here. Whether you live in a downstate county or you live in Cook County, you've seen too many politicians who love to use talking points. They love to come to you during election season, and then they stand there and they don't do nothing when they have to govern. We have to be the opposite of DC. We're not going to just be a TikTok 30-second clip promising things that will never happen. The work has been done here. Meeting with stakeholders, having those conversations. We need to put people over greed. We need to put healthcare over cost. That is what is so important in this moment. And I will say this is part of a much broader fight. I have to think, oftentimes pharmacies are in grocery stores, so we talk about grocery store prices. The anxiety you have going down to see the carton of eggs and how expensive they are, compounded with the anxiety that you have about whether you're going to be able to afford your medication. And then you bring that anxiety and you have the tough conversations about what you're going to do about your kid for that day. Those are all things together. Our job is to ease the burden and understand that these things are tied together and not in isolation. And so, look, we're going to face an immense amount of pushback on this. I mean, this is just the way it goes. And there's going to be people who are lining themselves hand over fist with money, benefiting from ginormous profit margins. The only people I want to see profit from this are the working class people of Illinois. That's why I'm proud to stand here and support this bill, proud to be part of this coalition, and proud to do this work. We have a lot of challenges ahead of us. We've had a lot of people talk about how we have to focus on the economy. Well, here's focusing on the economy. This is right here front and center. This is what we need to do. Thank you, guys. Thank you so much. And next, well, I'll have Anisha introduce. Thank you.
Thank you, Senator. Our next speaker is Ryan Grunenfelder with AARP Illinois.
Good morning, everyone. I'm Ryan Grunenfelder. I'm the Senior Director of Advocacy and Outreach for AARP in Illinois. AARP, we represent 1.7 million members here in the state of Illinois, and we are a nonpartisan, nonprofit organization who talks with our members across the state, and one of the issues that they consistently raise is the high cost of prescription drugs. And this isn't just in Illinois. AARP has 37 million members nationwide, and consistently across the board, we always hear about how the high costs of prescription drugs are affecting them, and they need some efforts to lower the price of drugs. And this bill is a very strong way to do it. And like Senator Peters and Representative Syed and others have said, this is a nonpartisan, bipartisan bill, and it makes total sense to pass it. Too many Illinoisans face the heartbreaking choice between paying for life-saving medications and meeting basic needs like food and housing. And these skyrocketing costs of prescription drugs drives up healthcare premiums. It drives up out-of-pocket costs, and it puts an unsustainable strain on older adults and their families. A January 2025 report, so released this month by AARP's Public Policy Institute, revealed list prices for the top 25 brand name drugs that are not currently negotiated within Medicare Part D have increased by an average of 98% since they entered the market. 20 of these 25 drugs greatly exceeded the corresponding annual rate of inflation. These are often life-saving medications critical to the treatment of diabetes, heart disease, and other debilitating diseases. Now, while those drugs are, those drugs are ones that are not being negotiated by Medicare Part D, so that is significant. But what's also significant is the people that are not on Medicare Part D, people that don't have good health insurance, are struggling mightily to pay for these drugs, because many of them may not just have one drug. They're paying for several drugs that they need out of pocket. And it's just unsustainable for them, and it is creating a ripple effect on the economy, on healthcare costs, and on their own pocketbooks and financial security in the long run. Being forced to skip or miss their medications seriously harms the quality of life and puts lives in danger, and this is completely unacceptable. And I really hope the Illinois General Assembly is able to support the creation of a board like this to keep these high costs under control here in the state of Illinois. So on behalf of our members and countless others, we urge lawmakers to support the Prescription Drug Affordability Board and rein in these high costs. Thank you.
Thank you, Ryan. Our next speaker is Dr. Anthony Douglas.
Good morning. Thank you, Citizens Action Illinois, Senator Peters and Representative Syed, for your advocacy on this issue today. My name is Dr. Anthony Douglas, ANTHONY DOUGLAS. I'm a general surgery resident at the University of Chicago. I'm here on behalf of the patients I care for every day. As physicians, we have a pulse on how everyday Illinoisans are affected by high out-of-pocket prescription costs. For physicians like myself, one of the most difficult conversations to have are with patients at the pharmaceutical counter. You can hear the worry, the desperation, and embarrassment of Illinoisans from the CVS or Walgreens counter saying, "Dr. Douglas, I cannot afford this medication." Even more difficult is watching your patient develop complications simply because they cannot afford their medications. A woman with type 1 diabetes came to our emergency department with appendicitis. Because she was not taking the insulin she was prescribed, her surgery was delayed. Her blood sugars were too high. When I asked her why she wasn't taking her medications, her answer was quite simple: "I cannot afford it." I have witnessed many people weigh the cost of medications with the cost of their mortgage, utilities, childcare, and groceries. They almost always choose the more pressing immediate needs over their medications. My father is one of those people. He was prescribed Jardiance for his diabetes. It cost him $660 a month to refill. He has since been switched to a less effective medication for his condition. More recently, my Uber driver to the airport, a middle-aged woman, shared that she underwent a kidney transplant a week before picking me up. She told me she was driving Uber because the cost of drugs to keep her brand new kidney healthy were too high. In our state of Illinois, 1 in 4 people ration or take sips of their medications to prolong needing a refill. I can tell you, drugs do not work like that. Failure to take your medicine as prescribed accounts for 25% of hospitalizations and 125,000 deaths a year in America. The lack of prescription affordability leaves Illinois residents to being hospitalized for conditions that could be effectively controlled at home if they could just afford their medications. In 2023, the United States Department of Health and Human Services reported 4,200 drug products had price increases. Just because a drug's price increase doesn't make it suddenly more effective. The average price increase was 15%, or about $590 per drug. The Inflation Reduction Act helped to reduce the price of a drug like Xarelto, a blood thinner I prescribe almost daily, from $517 to $197. Other drug prices were cut by 38 to 79%. However, it was only for people with Medicare Part D, but there are many other Illinoisans suffering. The young and uninsured who unexpectedly develop an illness, the middle working class who develop chronic diseases and whose employer-based or private insurance doesn't quite relieve the costs, ethnic minorities who are disproportionately uninsured, unemployed, living in poverty, and victims of health inequities. All of these populations are suffering. We spend hours as physicians filling out prior authorizations just to find out that even after insurance kicks in, the cost of a medication is still out of reach for many patients. The Prescription Drug Affordability Act is the solution to the problem in Illinois. The board will set upper payment limits for what Illinoisans will pay for prescriptions. This will make medications more accessible for those who are struggling to afford it. It's time we stop valuing profits over people. The pharmaceutical industry threatens that regulation of drug pricing would force them to remove drugs from the market. This is a fear tactic. In reality, the pharmaceutical industry is spending more in advertising to us than in research and development for new drugs. We pay more in drug costs than any other developed country in this world. Why should we have to import prescription drugs made and manufactured here in the United States from countries like Canada to lower what we pay for medications? We must stop valuing profits over people, especially when it comes to our society's health. Drugs do not work if people cannot afford them. I will and we must fight until I never have to hear a patient weep over the phone because they've been turned away at the pharmaceutical counter. Thank you.
Thank you, Dr. Douglas. Next speaker, Omari Prince from the Small Business Advocacy Council.
Good morning, everyone. I'd like to thank Representative Said and Senator Peters on your leadership on this important piece of legislation. My name is Omari Prince, O-M-A-R-I-P-R-I-I-N-C-E. I am the Government Affairs Liaison for the Small Business Advocacy Council. The high cost of certain prescription drugs drives up the cost of health insurance, which has a huge impact on small businesses. The excessive cost of certain drugs also impact the health insurance of our workforce, especially when people have to ration or stop taking needed medication. Excessive health insurance premiums and high drug costs are not political issues for us. These are small business issues, and we need to enact policies that address them. We support a PDAB to address the excessive cost of certain drugs. I ask the General Assembly to give this legislation a fair hearing and a full vote. Thank you.
Thank you, Omari. Next up, Timothy Jackson from the AIDS Foundation of Chicago.
Good morning, everyone. My name is Timothy Jackson. I'm the Senior Director of Policy and Advocacy for AIDS Foundation of Chicago. As a person living with HIV for more than 15 years, I am proud to represent the nearly 43,000 Illinoisans living with HIV at today's press conference. Across every corner of Illinois, from Metro East, Southern Illinois, and the Quad Cities, to Central Illinois, the suburban collar counties, and Chicago, families are being crushed by the rising cost of prescription drugs. Without question, access to life-saving antiretroviral medications for HIV treatment and prevention is critical for people living with and vulnerable to HIV, especially when prioritized among the Black, Latinx, and LGBTQ populations that are disproportionately impacted. Illinoisans living with and vulnerable to HIV and other chronic conditions are often forced to choose between their medication and other necessities like rent and groceries. What's more troubling is that there are some HIV antiretroviral medications that cost upwards of $4,600 for a 30-day supply. Simply put, prescription drugs don't work if you cannot afford them. AIDS Foundation Chicago is proud to support House Bill 1443 and Senate Bill 66 and stand here along the coalition and our legislative champions on legislation that would create a prescription drug affordability board that will work to lower prescription drug costs, which will in turn positively impact the health outcomes of Illinoisans living with and vulnerable to HIV and other chronic conditions. As I close, I want to be crystal clear that the status quo of Illinois families having to make life and death decisions between buying the medications that will treat their illnesses or buying groceries for the week isn't working. We need to meet the moment, square our shoulders, and pass meaningful legislation that will lower the financial burden of prescription drugs on Illinois seniors, veterans, children, and people living with HIV and other chronic conditions. House Bill 1443 and Senate Bill 66 are the reforms we need to do just that. Thank you.
Thank you, everyone. The coalition message is clear. Drugs don't work if people can't afford them. And since we ended last session, we had hundreds of conversations with Illinoisans across the state, and we had town halls from Rock Island to Chicago to Bolingbrook, hearing from people about the importance of this legislation. So we're really excited and energized to come back this session to get this across the finish line. And what's been incredibly clear this past week is that we should not be reliant on federal action, but we can definitely build upon it. And that's where the Prescription Drug Affordability Board builds upon federal progress to negotiate drug prices for Medicare. So what Dr. Douglas mentioned about the Medicare drug price negotiations, all of the prices that are negotiated through Medicare Part D will apply under this legislation for all Illinoisans, regardless of whether they're on Medicare or not. We'll now open it up for questions.
I just want to clarify, is there anything different from this legislation compared to what was filed in the past?
Very similar, maybe some small technical changes.
Okay. And then also in the past, when I've spoken to drug manufacturers, they say this doesn't really get the root of the issue, which is PBMs. I'm curious if you or any else up there wants to kind of address that concern.
I can start and then would love to hear from others as well. Even defining the word root, that is where something starts. If you look at the supply chain, it begins with the manufacturer and the purchase of a wholesaler from a manufacturer. Not to say that other entities in the supply chain aren't contributing to the issue. Citizen Action is a proud supporter of PBM reform and making sure that we have rebate pass-throughs, banning spread pricing, steering, regulating other actors in the industry as well. But if you regulate PBMs and you do nothing to prevent drug manufacturers from hiking up the costs year over year, that doesn't address, in your words, the root issue. So we need action on all levels, and I'll pass it to anybody else. Yeah.
I'll just say, I think what's clear is what came out of last year and the conversation we had last year is that people are upset about the cost of healthcare. People are upset about the cost of groceries. People are upset about the basic things that they need in their life. I think the approach that we need to take coming out of that, the fact that so many people are angry with both parties when it comes to what comes to their care, is we need to have a yes and approach. That of course we have to deal with PBMs, but we also have to deal with the broader levels of manufacturers hiking up a cost. Like, they're all together. Not only that, it's across the board when it comes to healthcare. I mean, this is the things that we're facing. And so, to be honest with you, we're not going to be pitted against one or the other. It's a yes and approach. And I think that for all of us, whether we're Republican or Democrat, we should see that. And so whether you live in a working class rural county or a working class urban county, you're facing the same challenges, and our job is to meet you where you're at, what you're facing, and say, how can we be a helping hand that lifts you up? So that when someone's walking through a grocery store and they're deciding, about their milk, or they're looking at their eggs, that they're not having in the back of their mind that last stop they make to the pharmacy as they wait and they wonder how much they can afford when it comes to their groceries. We want to ease that burden, and in order for us to ease that burden, we've got to take a yes and approach.
I obviously we've seen successful plans that have a lot of bipartisan support that get killed by Speaker Welch's Rule of 60. Does this bill have the ability to move forward this year and pass that Rule of 60? I mean, just think about lame duck session, you know, a bill that could have saved lives and gotten Delta 8 off the streets was killed because of the Speaker's rule. Is it time for that to change and actually have bipartisan legislation move forward like this that could help so many people?
What I will say is, I believe, especially now more than ever, we have the ability to get more than enough members on board to get legislation like this across. Because I can guarantee you, coming off of election season, many of my colleagues have heard at the doors that people can't afford groceries, they can't afford to pay their mortgage, and they can't afford their prescription drugs. So if anything, I hope, especially in light of what we've seen in this past week, the attacks that we are seeing on prescription drug affordability, the support that pharmaceutical companies are very publicly receiving by our president, that our colleagues here will do what I believe is the most morally correct thing to do and make sure that their constituents can afford their prescriptions. So I am confident through the advocacy of these people behind me, of the organizations, our coalition, that we can convince more than 60 members to support this bill and ensure that it gets across the finish line. Thank you.
There are a couple states nationwide that have these prescription drug affordability boards. Are any of them like a blueprint for how Illinois and you guys are kind of taking this on?
Yes, the most similar model is in Minnesota. And the reason it's most similar is because it also has the Medicare drug price negotiation attachment, saying that any drug that's negotiated, which, Jardiance, which is one of the diabetes medications that Dr. Douglas mentioned, that's one of them that was announced last September. And in January, earlier this year, they announced 15 additional medications, which includes Wegovy, Ozempic, several other high-cost and high-usage medications. So Minnesota has that as a part of their Prescription Drug Affordability Board, that upper payment limits can be set at that Medicare negotiated level for those drugs. I would say another similarity in another state is Colorado, and even though they don't have the Medicare drug price negotiation component, they do have a savings pass-through requirement. One of the questions that we got last year, and that was made an amendment to the bill last session, was, well, how do we guarantee that any cost savings by lowering costs at the manufacturer level or earlier in the supply chain, how do we make sure that actually reaches consumers? And so we looked at what other states were doing, and we saw that Colorado had a savings pass-through requirement. We don't have identical language in our bill, but we have language that requires and insurers to pass through savings with a priority on lowering enrollee cost sharing. So by reducing out-of-pocket costs or reducing health insurance premiums. That is a requirement in our bill.
Obviously, this legislation has been moving for quite some time now over the years. And you already mentioned we're in a completely different era. Many of these organizations that are the manufacturers donated money to the Trump administration for his inauguration day. How critical is this for the change to pass this year at this time when the industry is getting so much involvement in DC?
So, I mean, I think, not even just talking about the industry, I want to talk about the people of Illinois. They want this. Of course, industry historically has been barriers to the things that working class people in every zip code of Illinois need and want. And of course, there's going to be challenges with what's happening with the new administration. But we have a unique opportunity here to act. And I think it's our responsibility to do so. Again, I've said it over and over again. Over the last year, we've heard people talk about the cost of things that they need in their life. That it's pretty broad, that the pain that they're experiencing. The fact that we have such a high level of income inequality, the fact that people are disproportionately being impacted because of what's happening in the economy. I think if we have to choose between a CEO's next yacht or someone's vital drugs, well, I think for many of us, we'll stand with the person getting their drugs, and the person who might need another yacht can wait another year. So.
One thing I'll add on is, the person in our communities that can't afford their drug and their life depends on it, they don't care who the president is. They don't care where these donations are going. They don't care which stakeholders are involved. They just want to live. And that is what I believe legislators here in Illinois need to remember. And many of us do. We recognize that we have an obligation to our constituents who are in some of the most vulnerable positions. And they don't necessarily care about the politics of it. They don't care about what's going on behind the scenes. But the fact of the matter is they need to be able to afford their drug. And this is a step in making sure that they do.
Thank you so much. Any other questions?
Do we have an idea of exactly what sort of savings the average Illinois would see from a prescription review board? Just any idea come on that front?
It depends on the number of drugs that are reviewed and the prices that are reviewed and how different they are from the current prices. So what we could look at is the Medicare negotiated drug prices, because all of those drugs automatically would have an upper payment limit set exactly at that level. For some of them, it's like savings of $300 or $600 per medication, like a single use. We're still looking at information about the usage across Illinois, and it's hard to find information at folks that aren't on Medicare taking that, but definitely in tens of millions. If Medicare is supposed to save billions of dollars every year, and that list of drugs they're negotiating is going to grow, imagine those savings for Illinois taxpayers for everyone that isn't on Medicare. And state health insurance plans as well, because again, it's a requirement that you pass through those savings. So whether or not you take a prescription medication, this will benefit you with a reduction in out-of-pocket costs or a reduction in your health insurance premiums. Anything else?
And then has legislation been filed yet? Are there any bill number yet for these?
Yes, the House Bill 1443, Senate Bill 66.
I think that's enough for questions. Thank you, guys. Yes. Yes.
Thank you.
I'm just looking at your book.
Oh, yes, absolutely.
I like the, is it a notebook?
It's a notebook, and I got it from a business in the Quad Cities. One of my friends is a reporter out there, and she sends them over. They're fine. Mine's are. Quad Cities, there's a business over there that, I can't think of the name of it here. It's amazing. It's like a little